Hi, I'm Wendy from Dr. Harvey Levy and Associates office. If you're like most people, you may not give much thought to how you brush and floss your teeth. As your dentist and hygienist would tell you, how often you brush and floss and for how long can make a huge difference. Bacteria are everywhere, in your gut, on your skin, and in your mouth. Your mouth has billions of bacteria that reproduce every 5 hours. Most bacteria are good for us. Some are even necessary for survival. However, some types of bacteria can be really bad for us. This is so important, I'm going to say it again. Bad bacteria are the enemy. For the purpose of this video, when I say bacteria, I mean the type of bacteria that are bad for us. While you can't see them or taste them, bacteria can lead to tooth decay and gum disease. With a healthy diet and good oral care habits like brushing and flossing daily, you should be able to avoid serious issues caused by bacteria in your mouth. When bacteria enter the bloodstream, they cause an immune response that will affect the whole body. In your mouth, an immune response can manifest in 2 ways. An infection, an acute symptom like a tooth abscess, and inflammation, a chronic condition like puffed up, sore gums. An infection will usually bring you to the dentist as an emergency because you're going to feel a lot of pain. You may not think that chronic inflammation is that important. This is a mistake. Inflammation in your mouth is associated with serious diseases such as cancer, diabetes, stroke, Alzheimer's. The list goes on. Unless your goal is to experience tooth abscesses and chronic inflammation, here is where your toothbrush, toothpaste, and dental floss come in. Brush your teeth twice a day to remove the plaque and bacteria on the teeth and along the gum line. Floss once a day to remove the plaque and bacteria between your teeth. What should you use? A manual or electric? Ask your hygienist and dentist what they recommend for you. How often to brush? Using a soft toothbrush twice a day, preferably after eating and before going to bed. How long do you brush? 2 minutes, or sing the ABC song twice. How to use a toothbrush. A good technique is holding the brush at a 45-degree angle towards your gum line and brushing all the surfaces of your teeth, meaning the outer surfaces, inner surfaces, and on top where the chewing surfaces are. Hold your toothbrush with 3 fingers. This reduces the pressure of the toothbrush on your gums. You don't need to brush really hard in order to clean your teeth. It's all about the motion rather than the pressure that will clean your teeth. By allowing the tips of the bristles to do the work, your brushing will be more effective. So how hard should you brush? You just want to dislodge the plaque, which is a sticky substance containing food debris, saliva, and bacteria. So just brush gently as to not scratch the enamel. Overbrushing or heavy force when brushing can lead to sensitive teeth or receding gums. Brush longer, not harder. The bristles of a toothbrush can't reach between the teeth. This is why we need to floss. So do you need to floss between all of your teeth? Only the ones you want to keep. With the different varieties of floss that's on the market, ask your hygienist or dentist what they recommend for you. What is the proper technique? Wrapping the middle finger will give you the best control. Using a seesaw motion to get the string between the teeth and then slightly pulling the floss against the surface of the tooth, creating a C shape around the tooth. Move the floss up and down and move on to the next tooth. Using your fingers to floss can be more effective and less expensive, but it's not for everyone. If you do need to use the plastic flossers, that gets the job done too. Your teeth may feel clean, but look at the plaque revealed by the special disclosing agent. If not removed, the plaque hardens into tartar, also known as dental calculus. If you let tartar accumulate for very long, it will even get below the gum line. At that point, it can't get brushed away anymore. It needs to be removed by a hygienist or a dentist. Avoid all of that by brushing and flossing. Get rid of the bacteria before it causes damage. Cavities, abscesses, chronic inflammation, gum disease, tooth loss, you don't want any of that. The more you can do at home to reduce the plaque buildup, the healthier your mouth will be, and the less you'll have to spend on expensive dental treatment in the future. As Ben Franklin once said, an ounce of prevention is worth a pound of cure. Another kind of prevention is to visit your hygienist and your dentist, who will never judge you at the state of your mouth. At whatever stage your mouth is in, you can start brushing today.